So welcome back to Health Communication. For now, we're going to talk about interprofessional collaboration, and this will be really critical to understand some of the key components of what it takes to successfully collaborate, especially for your final project. By the way, I went ahead in the very beginning of the semester, as soon as your name's populated on Canvas, and just put you randomly in groups. So you can find all of that group information if you go onto Canvas and search for the tab that says People. It might not stand out. It might look kind of like a gray instead of being in black font. But under People is where you should be able to find your the 10 different teams. Most of them have 5 people. One group has 6 people, and you can begin working on your team charter that's due at the end of this week for your final project, which has everything to do with interprofessional collaboration. So some of you might get really excited when you hear about group work, but a lot of you might not get excited about this. Well, interprofessional collaboration is basically teamwork or group work. However, each individual on the team has their own different role, and you'll see that you have this exact same setup, I guess, for the final project, where each of you have a different role. We'll talk about what it takes to be on a successful team. So more and more healthcare delivery is going towards interprofessional collaboration. Let's take a look and see what that means. So the definition for interprofessional collaboration is when 2 students or individuals from 2 or more professions learn about and from and with each other to enable effective collaboration and improve health outcomes. Again, the intended goal of interprofessional collaboration, especially in healthcare, is really to provide a better experience for the patient, more well-rounded care, reduce any type of missed opportunities for prevention and control of disease, and really be able to offer the best and most well-coordinated care for the patient. So you'll see here in front of you, this is the Institute of Medicine's Future of the Public Health in the 21st Century report. And many components of the goals of this report really focus on strengthening public health infrastructure, but through collaboration, building partnerships with collaborative practices in healthcare and outside, developing accountability, emphasizing and translating research evidence, so what's worked and what's been tested in research, into practice. If you ever heard of evidence-based medicine, that's when, again, you're translating what's been seen as effective or more effective and really translating that into practice. And that often takes team, including the leadership of your healthcare organization, different levels of potential hierarchy, and different entities within a healthcare system or even within a healthcare practice to be able to, again, translate a new finding or a new medication or a new practice or procedure translate that into practice. And one key component, and again, the whole theme of this class is health communication, is communication. Because if you can't communicate effectively on a healthcare team, you don't really have a team. So here's a picture that comes from one of the readings that you were assigned for today's class. This particular name of this picture is the Framework for Action on Interprofessional Education and Collaborative Practice. So you see, previously we've had needs assessments. If you look at the far left bottom corner, you see the local health needs. You see a fragmented healthcare system, and then the move to improve the health system and to improve health outcomes is through interprofessional education. Who are the people who are going to be working together? What are their different roles? What do each type of professional and even individual on the team, what are their skill sets? What are their strengths? And also, where are some areas for improvement? Who's going to be communicating what? Who's going to be doing what with the patient? And how are we going to navigate a patient through a complex healthcare system? So that's where interprofessional education lies, is to let's train a more competent and communicatively competent healthcare delivery system to be able to provide better overall care. So that's where you see that collaborative practice There's some different competencies that make interprofessional collaboration function. One includes, we'll start with this role clarification, the green sphere. This is when learners or practitioners understand their own role and the roles of those in other professions, and they use this information appropriately to establish and meet patient, family, and community goals. The overall outcome is really trying to, and this is that red sphere, provide the best care for patients and families and communities. So we're trying to integrate and value as a partner these entities and incorporate that while engaging with the patient or family or client to design and implement care. Conflict resolution is knowing, really who does what, actively engaging self and other practitioners in dealing effectively with potential interprofessional conflict. If you don't agree with a diagnosis, if you don't agree with how someone practiced care, what do you do? And how do you resolve that in a professional manner that's really productive? All right, next we have team functioning, and that's when you understand the dynamics and even the principles of the team. You're understanding group processes and you're trying to really enable effective interprofessional collaboration. So who does what, who reports to whom, and in what way might there be some challenges in your team and how might you overcome them? Collaborative leadership involves learners and practitioners working together with patients and clients and families to formulate, implement, and evaluate healthcare and healthcare services to enhance health outcomes. So again, establishing, a form of leadership to really direct the way in which patients will be treated with the utmost respect, and again, with the goal of improving patient care. And really, what I think should be at the heart of this, although it's the very top in blue, is interprofessional communication. That's how different healthcare practitioners and different people in professions communicate with each other in a collaborative, responsive, and responsible manner, in a timely manner. Again, that will benefit the healthcare team as well as the patients who are going to be affected by this team approach in healthcare. So let's say that you've got, a very complicated patient coming in with HIV/AIDS, and let's say that potentially, although now we know HIV is treated more like a chronic disease and can be very well managed thanks to the improvement of antiretroviral therapy, if a patient is able to maintain adherence to their antiretroviral therapy. But let's say this patient fell out of medication adherence and suddenly their health is very complicated. They've got unmanaged HIV, they've got other what are known as comorbidities, other illnesses that seem to be popping up due to lack of being able to be maintained in healthcare. You might have a social worker who is helping that patient get the different services, community services that he or she needs. You might have a nurse that more often works with that patient, tries to get that patient adherent. You might have nurse practitioners who are helping to write prescriptions for other medications for the comorbidities, or even just to make sure that patient is somehow adherent to the antiretroviral therapy. You might have a physician who is part of this team. Nevertheless, there are teams that are working together to try to ensure how best to treat this patient, especially since this patient has a complicated health condition. There are a lot of different other examples. What do you do in times of emergency for emergency response when there's a disaster response? There are just, again, a myriad of examples. You can even work within what's known as integrated care, when you're working within a healthcare system that maybe has their own pharmacy, maybe has their own dental practice, and also has pediatrics, and also has pediatric care, and also family practice, all housed within one healthcare institution. In all of these examples, good, timely, clear interprofessional communication is absolutely critical, again, to make sure that patients get the best care. So again, what are some of the benefits of interprofessional collaboration? Well, this, by the way, comes from one of the journal articles that you were assigned to read, as well as from your textbook. So here are just some of the benefits that come from interprofessional collaboration. You can learn from other disciplines. You can also seek different perspectives on maybe how to treat a patient. Because you weren't trained within this one specific field, you might be able to gain new knowledge or awareness of how else a patient could be treated. It might lead to more innovative approaches for healthcare delivery. So really spark some creativity by having these different perspectives. It can present team members new opportunities for decision making. So it can blur some of those lines between the, maybe traditional hierarchy of who's making healthcare decisions in a collaborative practice. And that might make people feel more wanted within their workplace, more valued, and therefore increase retention and possibly reduce burnout. You can receive additional support, whether it be social support from someone working in a different field, or different resources might become more available to you because of this integrated collaborative partnership. Again, the overall goals are improved patient care and outcomes, which can be realized with effective interprofessional collaboration, and it can improve productivity. What are some challenges? And again, this might seem very familiar to you if you've ever worked on a group project. It can be hard. Some people are really great team players and some people aren't. It can lead to duplicated efforts if there's that lack of communication of who's doing what. Can lead to costly delays, and that can be particularly challenging for the health of the patient if they're not ordered a specific test on time or specific treatment because maybe someone thinks that another team member did it already. It can lead to frustration, right? Working with people can be so beneficial, but it can also be so hard just due to the different personalities, the different egos. Again, it can feel very frustrating and sometimes might even feel like a waste of time if nothing is actually accomplished due to not communicating effectively. So again, where does health communication lie in all of this? At the very heart of interprofessional collaboration. Also, another in that reading, especially when it focused on rural, that's such a hard word for me to pronounce, rural healthcare delivery, but just in healthcare delivery in general, when you've got a mix of full-time folks and part-time staff, some people might have been trained on this interprofessional collaboration, others it might take more time for them to get on board. This can be a challenge when not all components of this healthcare delivery system receive the same training at the same time. So it might lead to a little bit of a lag in not just collaboration, but in interdisciplinary practice. So again, communication is the foundation of this interprofessional team, especially a well-functioning team. And I really liked this quote that came from the Morris et al. Journal article that you were assigned to read. If you can't communicate, there is no team. This was a qualitative research study where two different healthcare delivery teams were interviewed and asked about the benefits of interprofessional collaboration and also some of the challenges. And one of the participants was just saying, basically, the role of communication is, it's everything. It's absolutely critical to know, what the left hand is doing so the right hand has that information. What is being done in terms of patient care, who reports to whom, who's doing, what in terms of providing that patient care. And again, appropriate and timely communication is absolutely key. So some of the communication do's, if you have your do's and don'ts list, we'll talk about a little bit about what you should do. Honor the individual team members' contributions. If you downplay the accomplishments of a team member, you're going to reduce their, not just rapport, but you're going to reduce their, I guess, esteem within the group, and that could affect their future contributions on the team. So really try to honor individuals' contributions. What do they bring to the table? Take time to get to know people on your healthcare team so you can build trust, you can build that camaraderie, that sense of, collaborative, not just a friendship or acquaintanceship, but just that level of understanding people on your team and trying to get to know them. Conduct team meetings with the goal of involving everyone. Now, sometimes you have some folks that aren't quite as vocal as others, and then other times you have people who really love to hear themselves talk. So sometimes it's a little bit of team management, especially coming from the original leadership, to really try to make sure that everyone, if they want to say, can have a say. Develop a better understanding of what different team members offer. Why are you involving different team members? Monitor the health of the team, and also be aware that conflict is natural. Just in any human relationship, people are prone to conflict, especially when there's a high stress and high stakes and disagreements about the way to do something within healthcare. So that's why monitoring the health of the team is so critical, so that when conflict arises, that there is good conflict resolution to therefore improve the health of the team. And again, all of this is with the goal of really practicing patient-centered care, reducing clinical errors, really making healthcare more effective, and again, overall improving the health of communities. So thanks so much, and that's the end of this particular mini lecture.